Hello and welcome. This video is all about what you can expect as you prepare for your radiation oncology visit. Your first visit is all about introductions and getting to know each other better. We will also ask you your name and date of birth at every encounter as part of our safety process. You will need to know the Social Security number and date of birth of the primary holder of your health insurance. You will also need to bring identification, insurance cards, advanced medical directives, and a list of all medications, including over-the-counter medications. The radiation oncologist will also want to know your personal health history. You may find that making notes beforehand can help. Also, a patient photo will be taken of you during this visit. This photo will be used throughout your visits for identification. Your radiation oncology nurse will meet with you to ask questions as part of your health assessment. You will then meet your radiation oncologist. He or she will examine you and review your diagnosis and treatment options. If radiation is decided upon, your nurse will go over any further instructions before your next visit. This first consult visit only takes about an hour. Your next visit will be your CT simulation. CT is short for computed tomography. A CT scan is a large donut-shaped recording system that takes pictures and creates images. Your radiation therapist will explain the whole procedure and place you on the CT table. If treated in the head and neck area, you may be required to have a mold mask made to keep your head in the exact position for every treatment. The CT scan is not a diagnostic scan and will not produce a radiology report. During CT simulation, a radiation therapist may mark your skin with a tiny tattoo. The tattoos are permanent and are done with a small needle, leaving behind a freckle-sized dot that radiation therapists use for precise daily treatment setup. And if a marker is used, small stickers may be placed over the marks in order to keep them in place until your next visit. Photos will be taken of your tattoos and marks, as well as mask mold setup. These photos will be placed in your medical record for reference. You may shower, but just be careful not to take off any stickers or intentionally wash off the marks. The CT simulation usually takes about an hour. The next step in your treatment process involves developing your individualized treatment plan. It is worth noting here that this planning period involves a radiation oncologist, a medical physicist, and a dosimetrist. These specialists develop and review your customized radiation treatment plan. You will not have an official appointment with all of them, yet you will receive a statement for all of these services. Now, once your treatment plan is finished, you'll be asked to come in for one more simulation session on the treatment unit that'll last about 15 to 30 minutes. We call this a dry run. Images and measurements are taken, and the shape of your radiation area may be drawn on your skin with a semi-permanent marker. Then photos may be taken and placed in your medical record for reference. Now, your radiation therapist will work with you on scheduling all of your future radiation treatments. Remember, the number of radiation treatments will vary according to your individualized plan based on the location and the type of cancer. During your treatment, registered radiation therapists will ask you to hold still while they use your tattoos and marks to properly align you for treatment, and will adjust your position as needed. Some images and measurements may be taken before you receive your actual radiation. The therapist will leave the room and monitor you with video and audio. Your radiation is delivered as outlined in your treatment plan. The amount of time the radiation is on is about as long as it takes the therapist to position you on the table. During your treatment, you will not see or feel anything, but you may hear a faint buzzing, and the machine will move around you. Once a treatment is over, the therapist returns to the room and assists you off the table, and you are free to go home. We hope this radiation oncology patient education video presentation has been helpful. Riverside strives hard to keep their patients informed with the latest medical advancements in order to make better decisions about health care. With locations in Newport News, Williamsburg, Gloucester, and on the Eastern Shore, Riverside Hospital strives to reach those who need them most.